Welcome back. In this lecture, we're going to take a look at sources of nutrition information as well as nutrition misinformation to help you to avoid being a victim of health fraud. And we're going to start out by going over a little example that I've seen recently in my clinic. I've had patients coming in who want to cleanse their colon. Now, if you think about colon cleansing, you think that kind of makes sense. Why wouldn't you want to clean your colon? But Mother Nature has done a wonderful job in terms of giving us a recipe for colon cleansing, and it's called fiber. There is no 20 pounds of waste product that accumulates on the inside of your intestinal wall. There is no reason to purify and detoxify yourself. But literally, over and over again, I see people coming in with colon cleansing, and essentially, most of the programs out there really are forcing diarrhea as a way of helping people to lose weight. Well, if you think about that for a second, if you have diarrhea, it's mostly water weight. So if you're getting on the scale after your colon cleanse, you're going to lose weight. But did you lose body fat? And the answer is no. So in this lecture, we're really going to try and separate the nuts from the berries, come up with a really good way of evaluating some of the information, talk about some good places to get information, and again, continue on that roadmap to wellness. Well, how do you separate fact from fiction? How do you know it's fact or fiction? I think that's a really difficult question to answer. And in my rice class, I used to assign an assignment where I'd have them evaluate an ad. And quite honestly, they couldn't do it. Unless you had a degree in biochemistry, sometimes the advertisements were so sophisticated that it was very difficult. Most of those sophisticated ads are actually coming from the internet. So the challenge for us is, how are we going to get this reputable source of information? Well, I had a patient who came into clinic, and she had been reading on the internet that Prozac antidepressant medication has a black box warning, which suggests there's some side effects associated with it. So she didn't want to use that evil pharmaceutical. What she wanted to use was a homeopathic version of an antidepressant. So we in our clinic did a little CSI nutrition, a little detective work, and we actually looked up the herb she was taking, and the herb contained strychnine. So she was every single day supplementing herself with a poison. But it sounded so great. It was homeopathic, it was natural. It was all of that compared to the warning she was getting about the prescription antidepressant. Trying to convince the family that this was a dangerous product for her to take was a challenge. Now, the key here is, even though it's a challenge, that family was really trying to protect their health. So in individuals who are trying to find alternative information, as a registered dietitian, I always look at that as a gift, because now I have people who are interested in making a change, but maybe need some guidance along that roadmap. They need some guidance along that path to optimal wellness. So what we're going to do is take a look at separating fact from fiction. We're going to look at how do I get good nutrition information, and most importantly, how can I avoid fraud? So I think the real challenge is that avoiding fraud. So that's going to come up over and over and over again in this series of lectures, is how do I as a consumer avoid fraud? Well, first and foremost, we have some information from the Food and Drug Administration that actually highlights the red flags of health fraud. How do you know when a product or a service or a device has, again, some reputable science, or is it making a claim? So if you hear any of these claims being made, you need to have your antenna up and say, now wait a minute, is this fact or fiction? Is this helpful or is it hype? And I also want you to ask the question, is there any harm to me if I do this? And I think that's the new avenue that I see with a lot of the alternative products that are out there. There is actually harm associated with them. And that's unfortunate in this day and age, that you have to be concerned about. I can go out and spend my good money. I can go out and invest in a product or a diagnostic test or something along those lines, and lo and behold, I could actually harm myself. Well, the first point is it a quick and effective cure-all? Well, just this morning, I was watching an advertisement on television for a new diet product. You didn't have to diet. you didn't have to exercise, and you could eat all the food that you want. Well, do you honestly think that it's going to be that kind of effective cure-all, that I don't have to do any work, I don't have to invest any time, but lo and behold, I'm going to get this great, quick, and effective cure-all with no effort on my part? Probably not reasonable. The other example I can give you is I had a young lady who came in and she was interested in treating her metabolic syndrome. Metabolic syndrome, again, is this pre-diabetic state. And she had gone to a curandera, a healthcare provider within her Hispanic community. And she was taking, again, an herbal product. It was a quick and effective cure-all. She wasn't supposed to have to do anything. All she had to do is take this product, and it was going to prevent her from developing diabetes. There is no such product. So that quick and effective cure-all is tip number one. To me, this is the most tragic one. Can it treat a serious or incurable disease? Again, in our life cycle, many of us are going to end up with a serious illness. And a product that you can buy from a consumer magazine, from the internet, or that you see advertised that can treat a serious or incurable disease, to me, is the ultimate fraud. Because what you're doing is separating yourself. You're separating that patient from treatment that may be life-saving or at least life-sustaining. And I think that's the real tragedy. There's been lots and lots of folks in the media, whether they're movie stars or athletes, that have had cancer, that have abandoned conventional therapy because they've read somewhere that they can take a product that will treat a serious or incurable disease. So I can think of an example where patients have gone to Mexico for Laetrile, or they've had aggressive breast cancer and they're using mistletoe. And initially, honestly, they'll feel better because chemotherapy, radiation therapy for the treatment of cancer is arduous, it's painful, it's challenging, and you end up feeling almost sicker than the disease. So you abandon that conventional therapy and you try something that you saw advertised that will claim that it can cure a disease, and lo and behold, you've abandoned your best chance at the best solution that you can get. There are claims oftentimes of miraculous breakthroughs, secret formulas, or, my favorite, the hidden ingredient that your doctor doesn't want you to know. So think about this one for a second. What they're trying to do is say your doctor doesn't want you to know, your healthcare provider doesn't want you to know. So what they're trying to do is separate you from reliable sources of information. Now, if you say, well, my doctor doesn't give me any good information and I'm not really getting better or having resolution of my symptoms, I would encourage you to find another physician. But having a miraculous breakthrough, a secret formula, or hidden ingredients that, again, your physician doesn't want you to know about, quite honestly, again, is one of those, uh-oh, ding, here it comes. I really need to watch, is this health fraud? Another one of my favorite ones, and you can tell I have a lot of favorites, is useless medical terminology to sell a product, such as thermogenic set point, lipoactive. It all sounds impressive, but oftentimes this useless medical terminology, you can't find it. There is no definition because it doesn't exist. And remember, we talked about one of the reasons why individuals struggle with nutritional science is they don't have a good enough science background. So if it sounds too impressive, if it sounds too good to be true, chances are it is. Another great evidence of health fraud, another great tip for health fraud, is all natural equals all safe. This one I have to tell you I scratch my head about. Where did we ever get natural and safe in the same sentence? So what's our alternative? All synthetic? All fake? We don't like those words, so all natural gives us this picture, this illusion in our mind of waving grains of wheat. We have this picture of nature in our mind, and we translate that to safe. Well, I want you to think of things that might be from nature that aren't safe at all. A couple come to mind for me. Heroin, cocaine, tobacco. All of those are natural products. I'm waiting for cigarette manufacturers to put waving fields of tobacco on their product to try and sell this as an all-natural product. All natural and safe are not synonymous terms. Personal testimonies. Even if these personal testimonies are from physicians, claiming amazing results. There was a famous athlete who was in a magazine endorsing a product. He was endorsing this product and he was saying this was the latest and greatest product out there, and it got him a Super Bowl championship. When he was interviewed afterwards of whether he actually took the product, he said, "No way, I don't take that product. My agent got me an endorsement deal for $50,000. Certainly in this category of personal testimonies, you've all seen pictures of before and after, where someone will claim they got amazing results from this product. Well, we're all smart enough to know that with some of the computer technologies that we have with Photoshop and other things that we can do to alter photos, just because you see it in print doesn't necessarily mean it's an actual picture. So these personal testimonies, endorsements, are all claiming amazing results, and you got to ask yourself the question, is this practically or reasonably true? And I think that's a challenge for all of us. Some companies will set the urgency, limited availability, act now, and you've all seen this on infomercials. For the next 30 minutes only, you can get this product, but it's limited availability, so act now. These products are in short supply. Well, we're all individuals who don't want to miss out on a good deal. We want to maximize the amount of value that we get for our money. So if a product is in short supply, why wouldn't I want that? Why wouldn't I want to jump on that bandwagon? And again, we create a sense of urgency that if I don't get this now, I might not get it. Well, I tend to try and track these commercials, and this limited availability comes back over and over and over again for the same product. So obviously they must be making more product because the supply is running out and they're making more and the supply is running out. So you see this all the time. No risk, money back guarantee. Where do we get that in the real world? If you go in and have a medical procedure, is it no risk, money back guarantee? I think the challenge is that when you actually track those that say money back guarantee, I'm going to encourage you to look at the flyers and the magazines that come in the newspaper. And oftentimes there's a P.O. box if you want to get your money back. And if you actually request your money back, it comes back to you saying that P.O. box is no longer active. So when something claims to be no risk or a money back guarantee, got a real challenge there because there are no guarantees in healthcare. We don't see no risk on the bag of potato chips. We don't see a money back guarantee on a bag of potato chips that if you have an adverse health outcome that somehow you can go back to the potato chip manufacturer. Promises of an easy fix for some things like weight loss or impotency. You see all these natural products being marketed for sexual dysfunction. And oftentimes within those products, they include nutrients that have as a side effect vasodilation. One of my favorite examples of that is niacin. Niacin is a B vitamin that causes vasodilation. So now I can take this all-natural product that's going to be my easy fix for impotency, and lo and behold, I can feel it working. My hands tingle, my face gets flushed, and the assumption is that somehow it's going to cure sexual dysfunction, and it doesn't work that way. If your sexual dysfunction is because of a nerve condition, it's a complex condition. Dilating blood vessels isn't going to be the fix. With weight loss, again, if all I have to do is take a pill and I can eat whatever I want, I won't ever feel hungry. It sounds so great and it sounds so easy. We really want to make sure that we've got that quick and easy fix. I can remember a family who had a daughter with a really pretty significant eating disorder, and she went to a naturalist in my hometown of Houston, and this naturalist said, well, we're going to do a bunch of skin testing and we're going to do hair testing and we're going to find the nutritional deficiencies. Okay, all I had to do was get some blood work done, and it had to be she was losing weight because she had some kind of toxin in her body. So they did a hair analysis, and it came back that she was taking an excessive amount of zinc. Well, what they didn't ask her was, what do you use to wash your hair? Well, she was using an anti-dandruff shampoo that had a lot of zinc in it, and so she didn't have a zinc toxicity. She just washed her hair with a zinc-containing shampoo. The other thing they